In this video, we're going to talk about lateral interbody fusion. There's different ways to approach the lumbar spine, and that by approach I mean to get to it or to access it. We can go in through the back, which is kind of the traditional approach, very standard, been around a long time. If it's a midline incision, it's sort of an open incision. If there's a couple or a single incision kind of off to the side, maybe it's a minimally invasive, but it's still a posterior approach. You can come in through the front, and that's an anterior approach. We do that for disc replacement. We do it for anterior lumbar interbody fusion. And then you can also come into the spine, or you can approach the spine from the side, or a lateral approach. So why would we do a lateral approach? If the patient has a particular type of scoliosis or deformity, the lateral approach can really help to correct that. Coming into the side gives you a particular mechanical advantage for certain types of misalignment in the spine. The lateral approach is a minimally invasive approach. We don't really have to cut any muscle to get in there. We have to make a small incision in the side and then separate the muscles in the abdominal wall. We go around the abdominal contents and then slide right down to the side of the spine. There's a muscle at the base called the psoas muscle. We retract that muscle. And when we get down to the disc, we have full access to the disc and can place large cages. And so that's kind of one of the reasons why the lateral approach is appropriate for some patients. What can you expect if you're having a lateral interbody fusion when you go into surgery? The recovery from lateral fusions is probably a little bit shorter than posterior fusions. I would say it's maybe 6 to 8 weeks. Sometimes we do the surgery as an outpatient. Sometimes the patients are admitted overnight to the hospital. The lateral approach can be combined with a posterior approach in certain cases, and we can do more than one level. So there's some variability depending on the specifics of your situation. What are the complications of lateral interbody fusion? The main issue, and it's a little bit different than some of the other approaches that can happen in some cases, is temporary nerve irritation and numbness and weakness. Because we're placing the retractor near the nerves on the side of the spine, they can be irritated from the surgery. It's very uncommon to have some sort of permanent nerve injury from the lateral approach, but it can happen. Rare complications like a vessel injury or a bowel injury or injury to the ureter can occur, but fortunately are much less than 1%. I think this is an exciting time for spine surgeons and for spine surgery and for patients with back problems. There's lots of different approaches, different technologies that are available. We can be less and less invasive. The lateral interbody approach fits in that continuum of improvement. It allows us to access the spine to address certain lumbar pathologies without cutting muscle, without losing blood, with getting a high healing rate or fusion rate, and correcting deformity or problems in the spine where the alignment's not good. The recovery from a lateral interbody fusion is probably a little bit faster than the traditional posterior approaches, even and including a minimally invasive fusion. The main issues that we see are transient or temporary nerve irritation.